In the past few months, the EPA has rolled back measures that limit hazardous materials and pollutants. While the EPA says public health will be protected, exposure to those pollutants can certainly cause a variety of health problems. And so because of that, our medical expert, Dr. Kohli, is here to take us through this. Perplexing to some, but what are we talking about?
Big changes is what we're talking about. So they basically repealed an act from 2024 called the MATS Act that was limiting how much heavy metal pollution could get into the air. So they went back to 2012 levels, which we knew were dangerously high, of lead, mercury, cadmium, chromium, all these heavy metals that are now going to be released in the air. So that's the big change number one. Big change number two is they got rid of something called continuous emissions monitoring, where all these power plants were required to have continuous emissions monitor so you could get real-time data as to how they're maintaining it. Now they've gone back to reporting it quarterly, which means obviously that they could just make sure they put their best foot forward when it comes time for the quarterly assessment. And in between those quarterly reportings, they could essentially have higher levels than allowed of these metals being released.
So what would be the motivation here? Is it, this is just me hypothesizing? Is it the companies? Is it the lobbying? Is it the bottom line, the money? I mean, they're supposed to be protecting our health.
Yes, it makes no sense. So there's absolutely no health reason to do this. The EPA says it is for economic reasons and for energy sustainability. So they think we've been too harsh on the power plants. They said overall the emissions have gone down, and they've gone down because we put in stricter limits, right? But let's peel back on this because we need this energy and it's going to sustain our economy. Now, what they're missing, the part of it that they're missing that completely is baffling to me, is that think about all the healthcare costs you're driving up by having all these extra heavy metal toxins released into the air with a lot of this deregulation.
You'll talk about the EPA regulations. For whatever reason, they're rolling them back, and people will automatically make this a political issue.
Yeah.
But as a doctor, what are the concerns about metal air pollution specifically?
Well, a number of doctors wrote an editorial in the Journal of the American Medical Association, but we're talking all kinds of health concerns. So we know that when air pollution goes down, we get fewer heart attacks, hospitalizations, asthma exacerbations, COPDs, and even less premature death. Now, when it goes up, the opposite happens. So we expect to see a surge in all of those signals. We know that lead is directly involved in neurodevelopmental delay for our kids. We also know that these kind of heavy metals, not only do they travel a long distance, they actually get into the water, they get into the soil, they can even get into our food because they can affect fish, for example, if they get into the water. And we don't have great ways to assay them. So when we go and buy fish from the supermarket, we don't know how much heavy metal toxicity it might have been exposed to, same for the water and the soil. And we know it's linked to, like I said, risk of dying, risk of having cancer, and potentially teratogenic for pregnant women that are carrying babies. It could actually affect the way their babies
This
born.
is maddening. I mean, you do everything you can, right? You want to work out, you want to eat well, you're trying to check all your boxes, and then this happens. Who is most going to be affected?
This is maddening, Sam. That's a great word. It's driving me crazy because as a cardiologist, one of our biggest barriers has been fighting the air pollution that's already out there. And now you're adding heavy metal toxicity on top of it. So the people that I'm most worried about, obviously pregnant women, people who live near these power plants, because it is a distance-dependent effect, are older patients for sure. And then anyone who has a chronic disease, whether it's heart disease, lung disease, asthma, because we know that these heavy metals in the air are going to cause more hypertension. They're going to cause more cardiovascular death. And these are already things that we're fighting with as a society.
These things tend to change with administrations. And that's why people say elections have consequences. This is just one of the reasons. But I'm wondering if you can quantify this. If a new administration comes in whatever 3 years and decides that they want to go back to where we were before these were rolled back, how much damage is done in those 3 years, and can you put the toothpaste back in the tube?
So the problem here is once your cells become cancer, they can't unbecome cancer, right? Once you get heart disease, once you die, once you get hypertension, a lot of those things are not reversible. So the less the exposure, obviously, the better. But my concern is honestly a bigger issue with all of this deregulation because we know that in mid-February, they rolled back the emissions limits on vehicles, which has been around since 2009. So now you're talking not just about power plants, but even the cars that we drive, giving us more air pollution, with air pollution being, according to the World Health Organization, one of the biggest modifiable cardiovascular death risk factors that we don't know how to modify because we don't know how to measure. So to your point, Phil, hopefully this won't get worse, and when the administration changes, the rules will change. But for now, I want every single person to take their health into their own hands. Think about the AHI, think about your distance from a power plant, think about those types of things, especially for pregnant or you're older, because that's the best you can do, is just put more distance between yourself and many of these chemicals that we're now going to pollute our
Well, I'm
air.
glad that you've brought it, front of mind, and people can advocate for themselves. So Dr. Kohli, we appreciate you as always. Thank you.